I think we should celebrate ourselves today for these three important documents: the Border on Human Rights, Universal Access, and then tools for monitoring and ensuring that there is a cafeteria of contraceptives available to everybody, both in rural and urban area. For me, these two documents are very key. I think they should package these documents for every department of O&G, every nursing department, every school of health technology, every ministries of health, every ministry of women affairs across the nation. Because we are good at producing documents, and the most embarrassing thing sometimes, somebody comes from across the Atlantic and says, "Have you seen this document?" And you say, "No, I've not seen it." In short, what I'm saying, ladies and gentlemen, again, is what I've been saying before: let us evangelize family planning so we can change the psyche of people to ensure that they understand why they must have the number of children they can cater for.
It is my belief that these three documents will both add to the body of knowledge and improve decision-making in the health sector, particularly in the area of family planning. I'm also sure that they will contribute to reductions in maternal morbidity and mortality and ultimately improve the health of our women and girls. These instruments include the National Depot Medroxyprogesterone Acetate, DMPA-SC subcutaneous, Accelerated Introduction and Scale-Up Plan 2018 to 2022. The plan was developed to ensure that contraceptive information and services reach women and adolescent girls who may want to avoid pregnancy, space, or limit childbirth. We have administered DMPA-SC to women in 10 states. In addition, we have distributed DMPA-SC nationally with support from UNFPA. And in 2017, we achieved the following: distributed 1.3 million units of DMPA-SC with support from UNFPA and DKT, Nigeria. Trained almost 11,000 providers to counsel on and administer DMPA-SC. Ensured availability of DMPA-SC in all the 6 geopolitical zones of Nigeria and in almost all state capitals. We reached new users of modern contraception, which suggests that adding DMPA-SC to the method mix is equal to expanding women's contraceptive options in Nigeria. May I add that Nigeria is the first country to introduce DMPA-SC in the African region. Currently, our modern contraceptive prevalence rate is 16%, and this is low. Furthermore, unmet needs for family planning is still high. It is estimated that 12.7% of women who wish to delay or prevent a pregnancy are not using any form of family planning method. These are clear indications that the country is yet to fully harness the benefits of family planning despite the scale-up in interventions.
It was at the 2017 London Family Planning Summit that international stakeholders committed to establishing a global FP-VAN. The Bill and Melinda Gates Foundation, the Department for International Development, DFID, the United States Agency for International Development, and the United Nations Population Fund committed to hosting and managing the global FP-VAN to ensure sustainability and community ownership. And Nigeria was selected alongside Malawi to pilot test this platform. On a day like this, we also wish to commend the Federal Ministry of Health in its effort at harnessing the potentials of depot medroxyprogesterone acetate, DMPA-SC, in order to improve access to family planning. We recognize that the plan to introduce the subcutaneously administered DMPA-SC is driven by the need to ensure contraceptive information and services reach women and girls that want to avoid pregnancy, space or limit childbirths, especially those who have been unable to access